Hi everyone, welcome to our CPT Surgery Coding video series. Today we're going to look at our 20,000 series codes for our CPT code set, and we're starting on page 111 in our 2020 manual. So on page 111, what you are going to see are the different anatomical sites that are included in the musculoskeletal system. So on page 111, it starts off with the general area. From there, on page 113, what you essentially are going to see is what I like to call the head to toe listing of all the different muscles in the body, the musculoskeletal system. So you see head, neck, back and flank, spine, abdomen, shoulder, humerus. On page 114, forearm, shoulder, hand, fingers, pelvis, hip joint, femur, leg, tibia, and then foot and toes. And then on page 115, you have application of cast and strapping, and then you have endoscopy and arthroscopy codes. Now, this is important to note that basically the procedures prior to endoscopy, arthroscopy, those procedures are either open or percutaneous or something that does not involve a scope. The other thing that you'll notice on these pages that there are anatomical diagrams, which I highly recommend that you refer to when you're coding. And then you're also going to note that these particular anatomical sites are in red, and then in blue, you have all the different procedures. So then over 116, 117, you have more anatomical diagrams, and then on page 118, you have some must-read information. I cannot overemphasize enough that if you are taking a national exam, you must read these subsection notes now while you are learning coding, because one of the things that you're going to find is that it's a lot easier to read them now while you're learning coding as opposed to when you are perhaps a month out from your national exam. So on page 118, you will find lots of definitions, and I just want to emphasize just a couple of them because I know you're going to read all of them. So number one, you'll notice under definitions, the definition of closed treatment and what that means. And closed means that the fracture site is not surgically open, and it also indicates that this terminology is used to describe procedures that treat fractures by three methods: without manipulation, with manipulation, or with or without traction. And then if you just pan your eyeball over to directly adjacent to closed treatment, you'll actually see what the definition of manipulation is. So again, consider these subsection notes like your roadmap for use of these codes. Then the next definition is open treatment. So the fractured bone is surgically open. The fractured bone is open, remote from the fracture. And then you also have percutaneous, which is describing skeletal fixation. This is where the treatment is neither open or closed. In this particular case, the fracture fragments are not visualized, but fixation is placed across the fracture site, usually under X-ray imaging. And one of the things that you want to pay very close attention to, speaking of X-ray imaging, throughout the entire surgery section is whether or not that imaging is actually included in the code description or if it's something you should code separately. The other thing that's important to note here is that the type of fracture, whether it's open, closed, compound, does not have any correlation with the type of treatment that was provided. So just because the fracture treatment was open doesn't mean that the fracture was open. So you want to allow the documentation to guide you. And then, guys, underneath there, lots of definitions, skeletal traction, skin traction, external fixation. So you definitely want to make sure that you read that entire page. All right, so let's, and there's more on page 119. So let's jump right into our first code family here. I'm on page 119, and under 100 on page 119 you have the wound exploration codes. These codes are designed to report traumatic wounds that result from penetrating trauma, such as a gunshot wound or a stab wound, a knife wound. These codes do include a couple of things. So they include the exploration and repair of the area that is related to the trauma, as well as some other components that I know that you're going to read because you have the subsection note there. In terms of the format of the code, what you'll want to notice is that they are divided by anatomical site. And all of these are known as separate procedure. And one of the things I challenge you to do, go back to the beginning of the surgery section and learn the definition of separate procedure. That's very, very, very important when you're coding surgery coding. All right, next on page 119, we have under excision, we have some biopsy codes, and there's something I want you to notice. So number one, there is 20200 and 20205. Notice the big difference here is one is superficial and the other is deep. But then when you go to 20206, notice that says biopsy muscle with a percutaneous needle. And then if you turn over to page 120, you have biopsy. Notice the shift in the word. So we're moving from muscle biopsy to bone biopsy. And then just look at all the different fractures that, or not fractures, but options that are available. I got fractures on the brain. All right, next up, I want to look at on page 120, 121, I want to look at under introduction or removal, the trigger point injections. There's a really cool picture on page 121 that talks about trigger point. And it tells you it's an injection of a needle into a muscle trigger point for injection of a therapeutic agent. So one thing that you're going to hear me say over and over and over again, don't just code words, know what the words mean. So like, why would somebody need a trigger point injection? What condition lends itself to a trigger point injection? Notice it says it's of a therapeutic agent. Well, therapy means to treat something. All right. So with these codes, 20552 is where your trigger point codes begin. You'll notice that the first code is divided by 1 or 2 muscles. And the second code is divided by 3 or more muscles. And I also want you to notice that it has the word, it has injections, in parentheses, muscles. So what that's telling you is that they can do several injections into 1 or 2 muscles, and that's 20552. Several injections into 3 or more muscles, that's 20553. The other thing I want you to note that there is a parenthetical note that says if the provider uses imaging guidance, you want to code that separately. All right, so that's all I wanted to look at here. And I'm just kind of looking at some of the popular code families. As you're listening to this video series, I challenge you to really spend some time not only with the guidelines, but just looking at the actual codes. Don't get caught up where all you do is focus on what you're studying, or if you have a activity that you have to turn in, that you focus on that. If you're reading about musculoskeletal for this week, get into musculoskeletal, because your biggest hurdle is going to be not understanding what you're reading. And if you get into it, you'll find that you will learn more than you ever thought. All right, so the next thing that we're looking at on page 121 is our arthrocentesis. And centesis is a surgical puncture to remove fluid. And so on page 121, continuing on to page 122, we have codes for arthrocentesis procedure, which are divided into 3 code families. 20600 is for a small joint, 20605 intermediate joint, 20610, which is a major joint. The other thing that you want to note is that the standalone codes say without ultrasound guidance, and then the indented codes, we have an option for with the imaging guidance. So very, very important to pay close attention to that. All right, next up, I'm going to go over to our introduction and removal, specifically the application or removal of these different devices, halo devices, external fixation systems. So you see those on page 122 and 123. So if you start on the bottom of page 122, what you'll notice is that the first code that you have, 20600 or 20660, this is for application of cranial tongs, and notice it includes the removal. Then when you go down over to 20661, I want you to notice that this is a application of a halo, including removal. And then we have 3 options. The standalone code is for cranial, the second code pelvic, the third code is femoral. Then we have 20664, which is still a halo, cranial, 6 or more pins placed. Documentation is going to guide what code you're going to select. And then if someone removes tongues or a halo that was applied by somebody else, we do have option 20665 to capture that particular service. When you're looking at a record, you're always going to ask yourself, who am I coding for and what did they do? All right, next up, we have codes for fixation, different fixation devices. And one of the things that you'll want to note about the fixation device, and I'm on page 123, I want you to notice that they're divided into uniplane system versus multiplane system. So you want to be very clear on what type of fixation system that your provider is using. Again, going to be documented in the medical records. All right, next up, over onto page 124, and we have some replantation codes. Now, what you'll want to notice about the replantation codes, and this I want to demonstrate the value of reading your notes, getting to know your codes while you're coding that system, because it gives you an opportunity to look through those code families and highlight different things that differentiate the code. So for example, code 20802 is replantation arm. The next code, forearm. The next code, hand. The next 2 codes, digits. But there's a difference between those 2 digit codes. Then you have 2 codes for thumb. Again, a difference between the 2 codes. And then you have foot. So if you take the time to highlight and understand the different nuances of those codes as you continue with the coding process, and if you're doing an internship or you're getting some type of on-the-job training, you don't want to spend all of your time at that stage having to become exposed to the guidelines. You already want to be exposed to them. All right, next up, we're going to go to grafts or implants. So that's taking us over to page 125. And the big thing I want you to note about grafts, it is very important to know what type of graft your provider is using. So for example, in 20900, those are for bone grafts, and there is 2 of them based upon if it's a small or a major area. Then you have 2 code options for a cartilage graft and a fascia lata graft and a tendon. And then you also have this add-on code at the bottom of page 125 for an allograft. And the allograft codes continue on the top of page 126. Again, it's going to be critical. I always say, when I'm capturing a code, I'm capturing the who, what, when, where, and why about that code that I'm actually looking at. I think that's a good way to think about it. All right, so guys, the rest of the musculoskeletal area, starting on page 127, gets into that head-to-toe approach that I mentioned. So again, each anatomical area has all the different procedures that you can code for that procedure. So incision, excision, repair, removal, different prosthesis. So I'm not going to go through all of them, but I do want to just kind of talk about some key things to look at and key things to know. So number 1, very important to know what body part your doctor is working on. And then you also, from a diagnosis perspective, want to be able to identify the types of fractures and dislocations. So knowing them by names, green stick versus comminuted. You'll notice here that I have diagrams of those different types of fractures because, again, you want to be able to visualize what you're actually reading in the record. So when you're coding the fractures, don't forget about the fracture treatment that we talked about at the very beginning of this. The other thing to note is with these particular codes, we do not assign an initial a code for the initial application of the cast. So I want you to think about it. If a patient has a fracture and the doctor takes them to surgery to set that fracture, he should not get paid extra for putting that cast on. The purpose of putting the cast on is to actually stabilize that fracture, the repair of that fracture, to allow that fracture time to heal. Now, if the patient comes back 6 weeks later and they're like, you know what, we're going to take the x-ray, take the cast off, we're going to x-ray, and they decide they want to put a cast on for another 2 weeks, then that secondary cast we can actually bill for. All right, the next thing I want to look at here, page 133, are for spine vertebral column procedure codes. So I think one thing I think is very important to know the anatomy of your vertebral column. So one of the things I learned when I took my anatomy class, and that's represented here, is that your vertebral column has 7 cervical vertebrae, 12 thoracic, and 5 lumbar. And those are the times that we're supposed to have breakfast, lunch, and dinner. So 7, 12, and 5. That's how I remember them. And then the 2 bones at the bottom, the sacral and the coccygeal, those are like the 2 snacks that you have. And if you sit on your 2 snacks too long all day, you know what happens. And so you got to have ways to actually remember this information. Now, from a coding perspective, on page 133, it starts off heavy with some subsection guidelines, as well as some really cool examples on page 134. And those examples are critical because it tells you really how to attack this particular area from a coding perspective, because a lot of the codes here are divided by the actual vertebral segment. And so if and when I say segment, so for example, cervical is 7 bones. They're known as C1, C2, 3, 4, 5, 6, 7. So if the doctor does a procedure on cervical C1 to C2 and C2 to C3, those are 2 separate segments and they each get their own code. So very, 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 very important to take note of that. The other thing I wanted to take note of is definitions that you're going to see here with regards to when we do or do not code arthrodesis. That's actually plastered throughout this section in the subsection notes. Again, even if you are taking a class where you have certain activities that you need to code, take the time now to just go through everything in the particular subsection that you're working on, as opposed to the month before the exam and you're trying to read through this. So don't just limit your experience to what you have to actually turn in for a grade. All right, the next thing I want to look at is known as spinal instrumentation. And spinal instrumentation is on page 141. And on page 141, you are going to see the definition of the different types of spinal instrumentation, such as segmental versus non-segmental. Guys, starts off here with a lot. Did I say a lot? A lot of subsection notes, and use a lot of parenthetical notes. If you look on bottom of page 141, 142, all you see are these big paragraphs of parenthetical notes, which basically tell you use this in conjunction with that. You also will notice there's lots of add-on codes. What do we know about add-on codes? Add-on codes cannot be used alone, right? We also know that add-on codes are exempt from the modifier 51. So you want to just make sure that you remember all of these little rules. And I know that, you know, it can get quite overwhelming when you are trying to just learn all of this information. So some of the other things that you'll want to notice here, and there's a couple of things I'm thinking about. So I mentioned the parenthetical notes, I mentioned the subsection notes, but then I also just want you to note the distinct differences in the codes, whether it's listed as anterior instrumentation or posterior instrumentation. So in addition to segmental and non-segmental, knowing that as well. And while we're on page 141, I did want to mention the spinal deformity codes. If you look on the bottom of page 140, there is a subsection note that starts off talking about spinal deformities and arthrodesis and how that is coded. So arthrodesis is binding or fusion of the spine. And these particular codes here, we're looking at arthrodesis procedures specifically for spinal deformity. Why I wanted to point this out is because there are some other arthrodesis codes, but they're not related to spinal deformity. And so I wanted you to just mention that or take note of that. All right, so next thing we're going to look at, and we're wrapping this up soon here, are codes for casting and strapping. And those are on page, starts on page 182. And what you'll want to know about the casting and strapping codes, they are divided based upon upper extremity and lower extremity. They're also divided based upon if it's a cast, if it's a splint, or if it's a strap. You do want to pay close attention to what the doctor is actually putting on. As I mentioned earlier, the initial cast is included in the fracture treatment or fracture repair. All right, and then the last part of the musculoskeletal area are the codes for arthroscopy. And one of the things you'll notice regarding our endoscopic procedures throughout the surgery section is that the surgical endoscopy, arthroscopy, always includes diagnostic. That's always included. Now, there are some situations here where you're going to be using modifier 51 if multiple procedures are performed through the scope, different areas. You'll note that as you're looking at the code description, you want to watch out for that. And then if you look on page 184, what I want you to notice, and we're going to really kind of end on two key concepts. Number one, very important to note the actual body part. So on page 184, we start off with the temporal mandibular joint, and then we have codes for shoulder. Then when we go over to page 185, we have codes for elbow, and then we have codes for wrist. We have codes for hip. So then we have codes for knee. Very important to know what body parts you're working on. Last thing I want to show you on page 186, I want you to note code 29880, 29881, 29882, and 29883. And what I want you to note here is that the first two codes, 29880, those are for meniscectomies, but I want you to notice some words. Very, very important. 29880, notice it says medial and lateral. 29881 says medial or lateral. 29882 and 29883, those are meniscus repair. And again, notice that key differentiation of medial or lateral. All right, thank you so much for listening to the CPT coding series, where we're focusing on the 20,000 series of the surgery section. In the next video, I will be looking at the respiratory system to kick off the 30,000 series.